Now, Keroles, Justine just made some great points about community data collection, and I think citizen scientists is something absolutely fantastic. It's on so many fronts, right? People get involved, people get to learn a little bit about science and research, but also doing their share as well. So you've had quite a bit of experience with this through your organization, Waste Not, Want Not. So tell us about this, because you have a sort of a broader picture of what's going on in the country.
Yeah, so I learned the hard way very early on that many of my assumptions that I had going in are just wrong. And however bad things look, and they do look very bad, when you dig in deeper, things are actually much worse. So at the beginning, like in a year and a half into Waste Not, we wanted to get an idea if we're making any impact at all, if anything we're doing is making a difference. And so we wanted to get the data of how much Concordia was composting beforehand and how much Concordia is composting at that point. And what I found out was that Concordia didn't track its waste. And so what we ended up doing is that I went in with a student intern and sat with a photocopying machine and scanned the invoices that Concordia pays to the waste management company, because we pay by metric ton and so on. And that way you can extract our waste generation data. But you can imagine my surprise that my own research institution does not track data. And at some point, we also have to think about why is a tax-funded public institution is not required by law to collect data and publicly report it. I think it's an important part of our transparency and ethical obligation to societies that funds us, but also within the context of an academic mission, which I think a big component of which is to help industry and government develop evidence-based policy. And one way to do that is to lead by the example of our own internal policies. But how can you possibly make an evidence-based policy if you don't track data? And another example that I want to bring up is my university had also a sustainability plan that was announced last year that includes a waste stream. But the last time we did a waste audit is in 2013, that's 8 years ago. And I think we need to do better. And that's why I'm very happy to be in this chat and talk about evidence-based approach to environmental crisis and waste management, because I would really like to advocate for strong regulations in place to make sure that public institutions and private organizations are legally required to measure, track, audit, and publicly report key environmental metrics that include waste generation, greenhouse gas emissions, and so on. And I say publicly report because no one should have to go through an access to information request to get environmental data. The last point I want to make is that it's really important to do all of this in a standardized way. And I would use COVID as an example at the beginning when we wanted to collect data, and Dr. Nimmer, you can speak to this a lot better than I can, because hospitals were reporting and measuring data in very different ways, it was really hard to aggregate data. And I think that was an even bigger problem in the States. And I will give an example with how my university reports data, for example. So waste diversion is a number that's usually talked about to talk about how much waste we're diverting away from landfill. So if I generate 100 kilograms of waste in a year and recycle and compost about 50 kilograms of those, that means my waste diversion is 50%. That's what people understand and think about when they talk about diversion rate. So because we have been tracking Concordia's recycling and composting over the past 5 years, we know that the actual diversion rate at Concordia is about 23%. But what Concordia publicly reports is 60%. And the way they do that is they use a standard called EC and Recycle, which I don't really understand, but the bigger problem is that other universities use different methods of reporting this. And most of them use actual diversion rate because that's what people understand. And I think this is important for two reasons. The first is that we shouldn't greenwash and mislead people. The second is that we need to be able to accumulate and compile data from different institutions, different municipalities, different provinces, and look at them at the aggregate so that we can develop national policies we so desperately need. And so this is the point that I want to make on this.
Well, look, you're making great points, actually, preaching, of course, to the converts here about data, about standardization, about data sharing. And we've talked a lot about this and struggled with it during this pandemic. I like also what you said about leading by example. I think that as individuals and organizations, we need to do it. But again, we need to agree on what we count, how we count it, how we report it, and from the get-go also to share the data so we can aggregate it and we can make sense of it for evidence-based policy and for solutions as well to all these problems. So thank you so much. This has been really eye-opening. It's what a great job you've done to raise awareness of the question of the issue, and also the complexity of the metrics in many ways, and the data and the actions that need to follow.